UNESO is an umbrella organization for sex work-led organization that was founded in 2015 by the sex work leaders. It was founded in a society that refuses to recognize sex workers' work and continue to discriminate and violate the human rights of sex workers. And the main mandate of UNESO is to bring together sex work-led organizations across the country to form a common voice to advocate for the human rights of sex workers in their diversity. UNESO is working in the joint advocacy for sexual reproductive health and rights, that is the JUST program, that looks at building strong social movement that challenges the structures and the invisible powers that hinders the realization of sexual reproductive health and rights in Uganda.
My name is Richard Lusimbo, and I'm the National Coordinator of Uganda Key Population Consortium, UKPC. We're delighted that UNESO was one of the founding networks. For a very long time, key populations had been spread across, but there was no unifying factor. So you'd find that there's a network of sex workers, there's a network of LGBTI, everyone was on their own. But in 2008, all organizations came together. So since then, we have grown and we've been engaging as a community, and I, as a founding coordinator, have played that role to work closely with all communities to ensure that their voices are heard.
My name is Dr. Adrian Juhu. I'm the Executive Director of Human Rights Awareness and Promotion Forum. And we've been partners with UNESO ever since their inception. First, we've been there much longer than they have been, but ever since the inception, we've been in partnership with them. At the same time, the people who are at the helm of UNESO, we've been working with them in different ways since inception. So for more than 12 years now, we've been working together on different aspects. I've been observing what's going on in the sex work movement and what's going on now that we have UNESO also in place. If we look on the positive side of things, we've seen quite a lot of developments happening. Sex workers now do hold trainings and engagements with the police officers. That's not something that used to happen before. I've seen UNESO itself getting engaged with trainings for health workers on issues of sex workers. That's something that used not to happen before. Now it's happening. So we are making some progress. We are getting there. We can train the police. We can speak to state attorneys. We can speak to magistrates. We can speak to health workers. And that's progress that we are making. And I like the idea of UNESO coming to bring sex work organizations together. It's a network of different sex work organizations. For me, unity is crucial. You have one voice. You stand up, speak with one voice. People who understand your issues, you come up together, speak with one voice. I think that's one of the beautiful things that UNESO has added to this whole equation.
Under the JUST program, UNESO is implementing its activities within two districts, that is Busia district and Guru district, and also at the national level, working with the civil society organizations that are working on SRHR. And specifically within the districts, among the activities that we are implementing, we have trained health workers on provision of friendly health services to sex workers. We have sensitized sex workers on sexual and reproductive health and rights. We have also trained sex workers on advocacy and movement building so that they may be able to advocate for their own rights. We have provided IEC materials that are promoting SRHR for sex workers, but also, more importantly, we are so much engaged and working together with the district health officers in both the districts, engaging them in our meetings and sitting on the round table to discuss and strategize on how we can promote sex workers' rights.
Sex workers are part of the key population, and the service we offer is uniform as for the key population. As I told you about issue of contraceptive methods, the one which is safe and affordable, we give them. Two, that's including condoms, and other long-term and short-term methods we give to the commercial sex workers. We give them the sensitive counseling as they come to facilities. What I mean by sensitive counseling, we look at focused areas based on the types of key population that we give them so that they understand how they can manage their situation. So the counseling is key, and in that we have mentored health workers to do that, especially in the hospitals, to make sure they do sensitive counseling to the key population. Then we offer quality obstetric and antenatal care for all the pregnant women and girls. What I mean by girls, to me, these are adolescents. So we offer for them obstetric care and antenatal service. As they come for antenatal, they come for obstetric gynecology issues, we give them critical services to them. And then another one is prevention and management of STIs, sexually transmitted infections, including HIV and AIDS, which is critical in this era, including the syphilis, which is also critical for them to know their status. On the other side of enforcement, we do offer the child and forced marriage services, where we have the child protection unit, which helps in serving this key population and the adolescents. So we have police, which helps us also in offering such services in the district.
My name is Batesha Miller. I am the co-founder and executive director of Organization for Gender Empowerment and Rights Advocacy that exists to promote health and human rights of LBQ and urban refugees living and working in Uganda through advocacy, documentation, strategic partnerships, and I'm also currently the board chairperson of Uganda Network for Sex Work-Led Organizations, UNESO, which is an umbrella for sex work-led organizations in Uganda. I would actually hit at the key challenges that sex workers face when it comes to SRHR, and one would be appropriate information, because when you look at sex workers, it's a diversified group of sex workers where we also have refugees, people from different diversities that speak different languages. And when you look at the public information, it's basically English, Luganda, leaving out some of the sex workers. So that is also one of the challenges. Then another one is discrimination and stigma, of course, which is triggered by the fact that both sex work and homosexuality is illegal, unacceptable religiously and culturally. So that also heightens the discrimination and stigma against sex workers.
So the fact that we have criminalization of sex work in the penal code, it makes it difficult for members of my community, the sex workers, to have access to their medical or their SRHR services. And this is one of the issues. The fact that sex workers are criminalized, so you find that their access to, let's say, HIV services is limited because they are always pushed in the corners, they're discriminated against, they are treated as nobodies by health workers. Let's talk about access to STI services, where health workers, members have told me, health workers tell them, for example, someone has come for an STI and they're like, I'm tired of giving you this treatment because tomorrow you're still going to come back with the same infection. Now, that kind of language puts off sex workers from coming to receive a service next time because they are scared to be castigated. They're scared to be being discriminated and demonized at the health facility.
All we've realized that we have a very vulnerable group of people within our settings. And as far as health services is concerned, these people's demand for health services is really, really very low. because of a few reasons. One of them, it is stigma attached to the kind of activity they engage themselves into. So they feel if they openly walk in and express themselves, the community would perceive them in a different way. And that makes it very hard for them to seek for health services. And in the event, you realize that these people are hit seriously with some of the sexually transmitted diseases because they could not seek any health support from anywhere because they hardly confide in anybody. So as TASO, they decided that they choose one person that if these people comes, will be directed to and they express themselves so that they can also be supported. Because as you all know, they do not want to be exposed. And I think this is evidence when you entered in the KP corner. It is very private and most of the KPs are liking it. So I think that is the background why we are offering the KP services here. And the past years, it has reaped a lot of success. In the community dialogues with the KPs, if you ask, you get the feedback that about the services they're getting here.
Tufuna obuzibu wetuba tugenzeyo okwejjanjaba tebatujjanjabira mu budde bagamba eddagala teririiyo. Tufuna obuzibu oba oluusi ogenze oyagala ka family planning ako osanga layini nga mpanvu naye otuuka ku layini nti naatera okutuuka wali nange bampandike mu kitabo kyange ogenda okulaba nga omusawo agamba gwogera oddako eri bano bakole ki basembereyo ate nga naawe oba oli mulwadde oyagala munnyonnyola ekizibu kye kikunyize kale n'oba nga tofuna bulungi bujjanjaba
pakiti kumima pakilaria kiteri ne ene mono eno mero gana ne azen kan no something dim mo chalo rap like rapping in kiteri ne ene donc chat so kitera kong dak bera side ki ko kitiki jomo kene ne ha yeno ke nene la chiana aya dim mo chalo yadi ene keno kene bana peki mini wa yar tumo mukene tie like kecharo kapenyo like things like condoms kiwachini condom matiene nak ku kang so ikuoro mogi dok dak iwach condom foot peki kelo
chalo ka chere ori yari mukene chalo an ki identity ma megani peberu ma yoto twal apoka ti madit chimutok tie ma no ka nyuta ni in beru ngat enni in da mai chate ki chimutok ki waje lugi lok ma duanta chi one girma ano perwate chalo yat family planning chalo kai mero chalo pep gi kong na ki wai chat wai police chako ki police mano te tie chao kende jara chero yat chawai da ka chero police ai ningam cheri victory ka ana chulu ali piara ka kemina pep.
Most of the female sex workers, they find it hard to access the services. They always complain about the attitude of the health workers. They will not, you end up not receiving equal treatment. Not all, but in some health facilities, you will not find the equal treatment. They'll put you somewhere. I understand you know this is a sex worker needs like an emergency. They first put you there. You also be there. Who told you to go there? So they first fight, get about for these ones. Yet this person needs a lot of support. So you find that because someone is a sex worker, but even if someone is a sex worker, this person remains human and she has a right to access services. So if this person is put on a hold, this person will not come back the next day. We'll end up maybe engaging in something which is risky.
Wofuna omuntu omulala toja mugamba nti nagenze kudwaliro nga nina obulwadde fulani olina osirika era naye oba olina omusiiga kuba toja kweyanjula ekirwadde kyolina oyagala sente olina osirika yakuwe sente omuwe byomuwa naye ate naye oba omusiize era naye ate abajja agenda osiga omulala.
The drugs which they bring in government facilities, they are not enough for STDs. So by the time we go out for these moonlights, they are out of stock. If they could increase on that package of STDs, these people are prone to STDs, but when they come at the facility, sometimes they get stockouts. When they test positive, linking them is an issue. Sometimes they think that when we link them and they start picking drugs from the nearby health facility, they lose customers. So what they do sometimes, when we test them positive, they will say, Katarika good, they let me migrate to another place. Also, sometimes they are rude. It depends on the mood we've got them. If the peers can help us talk to them, that when health workers are coming to give us services, let us be sober. Sometimes they are rude, especially to fellow women. They prefer males to women. And now you can get on the team when a female is the technical person and these others, their peers or their people living with HIV, whereby I have to go in and first talk to them before the service is conducted.
Another challenge that sex workers face at the health facility would also be the high rate of illiteracy among sex workers, where it's also hard for them to fill in the different forms or even read and understand exactly the prescriptions and all that. That is also very challenging. But also looking at the fact that Uganda does not fully embrace the universal health coverage. When you look at the accessibility, affordability, equitability, inclusivity, you find that KPs are not inclusive, especially when you look at sex workers. So this is also key. But also looking at the fact that the information, going back to the information as well, when you look at the patient's charter, sex workers are not well conversant with this, and this also limits them from accessing or demanding health services as they rightfully deserve.
When you look at how our country is moving because of discrimination or because of criminalization, it's very difficult to develop materials or communication materials that speak directly to sex workers, because then you'll be tagged as one who is promoting sex work. So that again becomes difficult, that then the targeted audience is not able to receive the information that it needs. That's why you see we cannot go out there and say, hey, we are having HIV testing services for sex workers here, or we're doing testing for sex workers. That alone will bring discrimination, and that's why you see that most of these services, civil society organizations like UNESO and the members are actually providing them through drop-in centers, bringing services closer to the community. And that's why you see different clinics like MAPI are being set up by government and development partners to ensure that the key population community can be able to access these services.
In most health facility, if you go, apparently they are offering KP services. But you know, things are being dwindled by the little resources that we have. And what might be here might not be elsewhere. But at least we are trying to make sure that health services are equally distributed across the health facilities, so that whenever they drops in, you know, these are people with unique character. One might prefer TASO, the other might not prefer TASO. So, but still, we need to support them with health services. That's why we had to distribute into other health facilities, so that if somebody comes and tells you, me, I fear coming to TASO, or me, I fear going to referral, or me, I fear going to La Ibiteco because of A, B, C, D. We have a vast array of services. At least the minimum package has to be there. So I think with that, and with a lot of sensitization from the KP-led organization and CSOs, the district or the local government as a whole have tried. Meanwhile, at the back of their mind, they still think this is actually not proper. But with the sensitization that the KP-led organization are bringing on board, I think it's really, really, really throwing a lot of light. And people are actually becoming to understand the importance of this fight. At one point in one of the forums that we had, one of the district officials was not pleased. But when he was explained that this could even be your own daughter doing this, so don't we have to support them? I think that gave him some bit of sense, and eventually, I think the district is supporting.
Looking at, like I told you, Busia is a unique district. Being a border district, our challenges are a bit different. Our sex workers are not being all that well coordinated because now they move between the borders. They cross the other side, their clients cross the other side and they come this side. So even comes to even healthcare, some of them cross and get services from across. But we are trying to, right now, we are trying to see how we can bring them on board, to see how we can, first of all, organize the design group which exists, and see how we can support them. Otherwise, we have had the clinics, we have had the small organized groups, 6 workers, that we are able to meet. And through these groups, we are in position to give them some care, just like another group of people. We are in position to provide them with the means of response towards protection of getting infected, then response towards also living positively for those who are positive.
Let's talk about issues of access to safe abortion services. We all know that in this country, abortion is still treated as illegal. Now, that alone makes it difficult when someone is a sex worker and then they are pregnant and they feel they need to terminate the pregnancy because one, is not good maybe for their business, but it's not the right timing. So you find that there are no specific facilities that could help sex workers to access safe abortion. While there may be different entities, but it doesn't mean that those entities have been prepared or set in a certain way that sex workers can easily have access to them.
Manga naliko ne boyfriend wange naye kati abadde anyamba kati nengenda nenfuna olubuto nesalawo nemugambako nti ndi nagamba nti olubuto si lwange kuba gwe oli malaaya gwegenda n'abantu bangi kati we nalabanga yeeganya olubuto nengendako ku gavumenti nenzinyonyolako dokita neŋŋamba omusajja yeeganya olubuto n'alutwala walwa mwezi gumu nyamba ndujjemu nagamba njagala mitwalo nagamba ekitono ennyo wenkuyamba mitwalo 5 naye nga omanye embeera ya covid nali sirina ssente andinawo mitwalo gumu kale nendaba nga nyigirizwa nnyo mu mutima gwange ate nga gavumenti yerina otuyamba mu bintu ng'ebyo era naddayo ewaka nenkozesa jasita ebiragalalagala byebyalugjamu katonda n'ayambira awo kale eyo embeera gye tunyigirizibwa ku gavumenti eyo.
Services ezikiwa nti mu Uganda tuyinza zifuna kubanga nga kikaluba ekya abortion kyo bakyogerako naye services zaayo tetumanya kuzifuna saagala kulimba kubanga amazima gali nti mu madwaliro agasinga niwe ba health center for teri health center kwa services za abortion ekyo bakitugamba kwa kati abasawo beekwasa nti bayina free family planning ni bakubuza bwe wafunye lwaki ngate mwina wano services za family planning ezobwe baki wagenze n'olufuna ekitegeera nenga bwe kunyo nte twade tutegese boyinza okgenda olumolo noga akankwate 10 lino ogenda okwebala mu nnako ngoba mu weeks 3 ng'oli lubuto ate ng'olusite wanetaza kuzaala kuba kati nze nange sana ndwalo nenkugamba nti nze okwongerako okuzaala ku baana benina wakiri mpandu jamu.
If something happens and he or she comes and tell you, me, I cannot maintain this. So for my safety, I want to remove. And you realize as TASO, we don't do that. So after a rigorous discussion with the person and going an extra mile to ascertain that this is really what the person feels and this is the right. So we need to refer, you get the point, to an appropriate care and support so that it is always safe. We advocate for the safety. If it is going to happen, that is.
One thing I would want to say is that the situation legally is not changing that much for now as regards sex work. People have spoken. We've had advocacy campaigns taking place. We have more engagements with the police, but the law still remains unchanged. The penal code still remains criminalizing sex work. Not so many people are being arrested and charged with what we call prostitution in the laws, but nevertheless the constant scare, the law's existence is people to be scared, but also it allows the police to go and arrest them anytime that it wants. That's the danger of the law. Of course, if you add things like being idle and disorderly, being a rogue and vagabond, being a common nuisance. All the things add to the nuances of what can happen to you in case you get arrested. So the police have a justification to always go to the streets, pick up sex workers and arrest them. And COVID-19 made it even worse. During COVID-19, we saw an increase, we saw a spike in the arrest of sex workers, mainly because sex workers almost had no option. They had to be out there working. And then when you go working, they pick you up because first of all, you're violating the curfew. That's working beyond, at that time it was 7 p.m., working beyond 7 p.m. Now, if you ask yourself, when should a sex worker work? As in, sex workers usually work at night. Number two, if you come to think of it, they're going to have to move long distances. COVID-19 period, again, no transportation. They have to move long distances, go meet clients. And what happens eventually is that some of them are violated in the process. You have to spend a night wherever you went with someone whom you don't know, and that's dangerous, and there's nowhere to run. So the criminalization of sex work also leads to the absence of protection. So it's not just that it's just the criminal law. Yes, the criminal law is there, but even if someone is not convicted, what about protection? Can I go and report a case of violence if I'm a sex worker? Those are challenges. We still have that as the law. But for me, as always, I engage a bit beyond the law. Let us go beyond the thinking that the law is the solution, that when the law changes, everything works out for the better for sex workers.
If you try to see very well the sex workers, if you go and try to arrest them, will you have any evidence? Most of them you will not get any evidence. Then you will release them out. They are only being mistreated by the law of the government, but if you are to put it correctly, they want government also to take note of them. So that's just kind of law should be put aside at least to make them also be known. And they should practice their work openly. But now they are still practicing it illegally.
During programming and project implementation, we as a district, we have decided to involve all the stakeholders. And one of our critical stakeholders is the key population. We have a representative, at least male and female, whoever come during time of designing and implementing projects. One example, if it's an HIV project, there is a person responsible for that. So we bring the key populations on board, especially come sex worker representative for men and women, and then we bring in the other teams like people living HIV to be on board, and then we bring in the technocrats and other departments, make sure that our plan, our design is comprehensive. We don't leave anybody behind. We make sure we integrate everybody into that one plan. So we said delivering as one.
I think just to quote what I said earlier, the universal health coverage, I think even the health workers need to be sensitized about the universal health coverage, to know that you don't just say equitability, inclusivity, but also in practice. So what they pin on their walls that do not reflect exactly what they do on ground, what they do practically. I think we've got various opportunities. We just have to find ways of tapping into them, looking at the fact that some of the entities are coming on board to work closely with us. Back then it was really hard. Looking at the fact that Ministry of Health is working with us, Uganda AIDS Commission, that is a plus on our side, but also looking at the available funding that directly funds our different interventions that are both responsive and sustainable.
We need to engage them in more of the dialogues. Dialogue should just be one after the other, because this is also out of experience. We get to know all these ideas when we actually bring them together, and then they discuss on the issues that they feel can be addressed. Because I cannot pick one of them, then I think I'm going to get a comprehensive statement that is going to inform our services or decision. So one key thing that we really need to deploy, it is, if not routine, then quarterly community dialogue with the KPs, so that we get to know some of the concern. Because I strongly believe what I think might not be the same thing that it is actually in their head. So when we get to them, sit with them down, discuss with them on some of these issues, then eventually we shall get to know what are the areas that we need to concentrate our energy in.
For me, the first thing I would say is, even before we change the law, is the empowerment of sex workers. We need a cadre of sex workers that can stand up and defend and protect their rights. Right now, many sex workers, can I call it feeble? They don't stand up to demand. They don't stand up to protect themselves. They believe that if you go, once you are arrested, you go and pay a bribe. That's the end of the matter. They should know that the police should not arrest you in the first place. That's something that goes not just to UNESCO, but also us as Europe. How much have we done to sensitize and to employ sex workers? I've seen us training paralegals here. And when you train paralegals, you see them being different from the rest. They know what they stand for. They know what their values are. They know what to demand for. Many of them don't have that kind of spirit to do that. So for me, UNESCO and also others need to start actively empowering sex workers to demand for their rights, to demand that they shouldn't be arrested, regardless of the law, not necessarily the law criminalizing sex work. Criminalization of sex work is not the same as you beating me up as a policeman. So that's one thing they should work on. The second thing they should work on is really ensuring that the judicial system, the legal system, the police, the law, the justice, land order sector understand sex work issues. It's not a good thing to assume that people know things. It's not a good thing to assume that people are against us or they don't like us. We need to have what we call strategic engagement with all those partners. We should go beyond the police. There's the DPP, the state attorneys who file and sanction files. We need them. We need the magistrates. We need to talk to the magistrates about who sex workers are, so that when the sex worker appears, the magistrate understands the issues that are happening. So there's need to go beyond and we engage much more with the justice system in its entirety, not just the police, but also the different actors that are there within the police. Of course, thirdly, I would speak of decriminalization. I have a feeling the campaign to decriminalize sex work is not as much as it used to be. We need to kind of put a little bit more energy in decriminalization. It's not necessarily the courts alone. I usually prefer decriminalization through Parliament. Financial sex work, which is controversial, Parliament can actually change the law. Surprisingly, when they do that, it's more popular, people understand, than if it's just the courts that do it. Yes, we may go to court, but before we go to court action, have we really tried to build a campaign why we need protection for sex workers, why we need the link between sex work and HIV, the link between sex work and the lack of protection, the link between criminalization and the fact that people are dying. People would kind of understand these issues and work towards decriminalization. So for me, I think UNESCO should remain political, should remain politically active, politically engaged in the campaign to decriminalize sex work. Without that, because it's well situated, it's an umbrella. So as an umbrella, you can actually go and demand. And that's something that they should keep on getting engaged in and doing to ensure that eventually we have some sort of change as regards the law. And because when the law changes, our society also twists you, also shifts and changes.
I think UNESCO should go ahead with the national kind of advocacy and engagement, because when you look at the various organizations in Uganda, we have a different level of advocacy. It could be community level. So there's a way UNESCO unifies our efforts, and it also makes it easy for us to even approach such entities. Now, when you look at their approach with the district health officers, when you have an initiative in any district, it's easier for you because it's just a connection to that DHO and everything is easy. But I think they should also look at sustainability beyond project, because funding is not sustainable at the moment. So it is important for us to think about sustainability of organizations beyond project funding. How can we sustain our work? How can we still exist and still push with what we can do that are non-financial? Like if we've created partnerships with different health facilities, we know we can still gain from their services, even though we don't have funding within our organizations. I think that is very key at the moment, because we all look at funding being very competitive at the moment, and the donor dynamics associated as well.
At the national level, a lot of synergies have been built that partners are working together, which is not yet at the grassroots. So I would recommend that now the more synergy should be now transferred to building consortiums, coalitions, or working together at the grassroots level. Because sometimes you go in the districts and you find there are many players, maybe if I can say there are many organizations which are working on SRHR, but they are working in silo. They do not know each other. They do not know what their what each other are doing to promoting SRHR, but they are all contributing towards promoting SRHR. So it would have been better if those organizations could be like a mapping of CSOs and identifying them to get to know each other and complement each other, because at the end of the day, they are all contributing and they are all working to contribute towards promotion of health.
They should increase on the sensitizing the community about these key populations, because they are the ones marginalizing them and discriminating them. They look at them as criminals, but they should sensitize the community that these people are existing and we learn to live with them. And it is these other people, the community members, who are going there to buy sex from them. So they should sensitize the community that when you see the health workers going to help these people to give them preventive services, they are helping the entire community to spread the HIV. And if we are to achieve the 95-95, we need to go really to these people and give them all the services.
Sex workers are family, sex workers are us. So if we choose to demonize sex workers in the media, that's what a young person in the community is going to think. An elder person, a middle age, or all people of ages, that's what they're going to see. So there is need to have dialogue with media to start writing or to start showcasing information that is positive. And that's how we're going to change how people are perceived in the community. Because what is written in the media, what is written on social media matters in this age and era.
We need to have humility. When we come to the facility, we need to respect one another. We know, we understand them very well, and we really know that we really need to support. But, you know, at the health facility, there's what we call triaging. If your condition is more worse than my condition, then you become priority. So with this, the message that I'm sending to them is, we know where they stand. We appreciate it. But if they come to the facility for services, we actually call for patience, humility, and respect of one another. That is my last message for them.
First of all, there's recognition. And that's a good thing. By the already, there's recognition of sex work as one of the key populations. That is less controversial. It's already in the laws, the policies passed by the Ministry of Health. So what we need to do is to leverage on this. If it's in the policies, if we have these policies advocating non-discrimination, then health workers cannot start discriminating against someone based on the work that they do as sex workers. That means that we can demand, the law is already on our side in this respect. That means we just need to keep pushing. But first of all, before we push that much, the trainings, UNESO, I'm sure, has been doing trainings on for health workers. Those ones need to continue. Engage health workers at all levels, especially those ones who most interact with the clients. Let us continue also training peer leaders in that sector, in the health sector, to help provide preventive services for people who are sex workers. But also, let us do the trainings of actual health workers on what the law says, what the policies say, and proper practices towards protecting sex workers from HIV, but also treating them as human beings because they are human beings and because sex work is certainly work.
Health is a priority. And whatever happens, health should always be prioritized. I'm saying this is not the time to cut the health budget. The government should consider instead increasing the health budget. And for the sex workers' rights, I recommend that sex work should be recognized as work because it is the best, the legal framework about sex work has been the best for all the human rights violations that are happening against sex workers. So if sex work can be recognized as work and decriminalized, we believe that we can realize all the human rights for the sex workers.
I think sex workers as a whole, we've done a great job, but also looking at the the fact that we are working together because we have a common goal. We have joined efforts at national level, UNESO being the umbrella that brings all of us together, looking at the fact that sex workers come from different districts, but we end up having a common voice. I think that is very recommendable, and I would love other sex work groups to come on board so that we can have a unified and strong voice.
Off we go. Jericho. 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 Jericana. 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 Fire.